name is Simon Bailey. I'm a Consultant General Colorectal and Laparoscopic, that's keyhole surgeon. A hemorrhoid is essentially a swollen blood vessel around the anal canal margin. They're akin to varicose veins that develop in the leg, but unfortunately they're very common and very irritating. Firstly, it's important to take a good history from the patient, who generally have been suffering from the problem for quite some time, and then physical examination is required. As part of the history, patients often experience pain, swelling, itching, intermittent fresh rectal bleeding, and just general irritation and discomfiture around the tail end. On examination, it's possible sometimes to see the external hemorrhoids, although this is uncommon, but generally one needs to feel the anal canal in order to assess things. It may also, in the clinic environment, be necessary to have a little look with a small plastic tube called a sigmoidoscope in order to assess things. After the history and examination within the clinic, it may be necessary to investigate the source of the bleeding and the anatomy of the rectum and anal canal properly, and this is done with a flexible sigmoidoscopy in the endoscopy unit. It's a day case procedure and takes about 10 to 15 minutes, but it allows appropriate assessment of the hemorrhoids, but also to exclude the cause of bleeding coming from higher up within the colon. There are an awful lot of treatments for hemorrhoids. They can be divided into lifestyle or conservative treatments, and then of course surgical treatments. Lifestyle treatments include increasing the amount of water one takes in a diet, lots of fresh fruit, vegetables and fibre to keep the stool as soft as possible. Gentle exercise helps with gut motility, and we could all do with losing a little weight, and keeping the weight off certainly helps prevent them coming back. There are then the over-the-counter preparations, which don't change the course of the problem, but certainly soothe the area and make things more comfortable. Warm baths also help on occasion, and resting with the legs up can help acute exacerbations. Then of course there are the surgical options, which range depending on the size of the hemorrhoids and their location. Traditionally, banding or injections with a sclerosant which shrinks the hemorrhoids are possible, both in the outpatient department or more usually in an operating theatre. There are more modern techniques with better outcomes, which include the halo procedure, which involves identifying the arteries that supply the hemorrhoids and tying them off under a brief anaesthetic. It's also possible to cauterize them with a technique called the Raffaello procedure. For larger hemorrhoids, more significant operations are required, and this can include a stapled hemorrhoidopexy, which is a technique of removing a small tube of tissue and disrupting the blood vessels, or for certain types of hemorrhoids, the surgical removal of the hemorrhoid is required using a formal hemorrhoidectomy, although these days this is more uncommon. Recovery is a very individual process, but generally speaking, patients need to take 2 weeks of proper rest and recuperation afterwards, and a month where they avoid strenuous physical activity, heavy lifting or constipation. In the first couple of weeks, it is important to maintain lots of fluid and fibre, plus or minus laxatives to keep the stools as soft as possible. Simple pain relief is all that's usually required in order to keep comfortable for the first few days, and rest and gradual return to normal activities is generally the key over the first 2 weeks. I advise everybody to consider taking 2 weeks away from work in order to maximise their recovery rate. Going forward thereafter, it's important to avoid heavy lifting of anything over 10 kilos for about a month after the surgery, and I advise everybody to be careful about returning to the gymnasium, getting onto a bike, running long distances and so forth, until the month mark, to give the operation the best chance of healing completely and minimising the chance of the hemorrhoids coming back again. There are lots of ways in which you can see a consultant, either at Kim's Hospital, the Sevenoaks Medical Centre, or Leica Health Orpington. There is the choose and book system via the NHS, where patients can be referred in a timely manner by their general practitioner on the NHS. There are packages available for patients who wish to pay for their treatment themselves, and these are available via the website at the hospital. And finally, there are those insured patients who can utilise their insurance as and when they require at a time convenient for them.